Welcome to my YouTube channel. Today we're going to talk about classification of ulcerative colitis. Make sure you subscribe. Let's dig in. So in terms of classification, before we start classification, I hope you know what ulcerative colitis is. And ulcerative colitis is part of the umbrella of inflammatory bowel disease, which is a chronic inflammatory bowel disease that involves the colon and the mucosa. Like those two keywords, colon, mucosa, should be ringing in your bell when you think about ulcerative colitis. So let's dig in. So in terms of classification, we classify the disease according to extent and classify the disease according to severity. So in terms of extent, we use the Montreal classification. And then the disease is characterized now into three, where you have ulcerative otitis, left-sided ulcerative colitis, and extensive ulcerative colitis. In terms of ulcerative otitis, the mucosa involvement is the rectum. Mucosa ulcerative colitis, mucosa ulcerative colitis, mucosa ulcer. I have to ring that bell so that for you not to forget that ulcerative colitis, mucosa. Ulcerative colitis, mucosa. Now let's continue. Sorry for that if that was really irritating for you. But we said ulcerative otitis, it's limited to the mucosa of the rectum. In terms of left-sided ulcerative colitis, it's where ulcerative colitis is just limited on the left-sided. That is from the splenic flexure, descending colon, and then to the rectum. And then in terms of extensive ulcerative colitis, is where the ulcerative colitis is limited, is found in the rectum, descending colon, and advances proximally advances proximally to the proximal to the splenic flexure to the side of hepatic flexure. I hope that is really understood. Next, in terms of severity, it's now divided again into three according to endoscopy finding, clinical presentation, and combination of both. In terms of endoscopy finding, we have two scores, that is the ulcerative colitis endoscopy index severity and Mayo endoscopy score. So you're going to start with this Mayo endoscopy score, which we score it into four scores, it is 0 to 3. In terms of 0, we have disease activity, that is normal or inactive. In terms of endoscopy findings, we have none. In terms of score 1, where we have mild disease, we have just erythema, decreased vascular pattern. In the next slide, that's what you're going to see more. Decreased vascular pattern and mild friability. In 2, we are going to see moderate, that is marked erythema, absent vascular pattern, friability, and erosion. In 3, we are going to see that is severe, that is spontaneous bleeding and ulceration. So before I go to the next slide, kindly note in terms of endoscopy findings, you look at three things: bleeding, erosion, bleeding, vascular pattern, erosion, and ulcers. I repeat, bleeding, vascular pattern, erosion, and ulcers. So if you note, we see erythema, that is vascular pattern. We also see erosions, that is friabilities. We also see vascular pattern, erosion. We go to the next. So in terms of Mayo, we said there are three. This is just for you to remember and just for you to visualize. In terms of 0, it's normal or inactive disease. You can see this is a normal. We can see normal vascular pattern. There are no erosions. There are no ulcers. The intestine actually seems to be very well. In terms of 1, where we have mild disease, you can see the vascular pattern is kind of obliterated. So we have decreased vascular pattern, and you also have mild friability and also erythema, as you can see here. In terms of 2, where we have moderate disease, we have marked erythema, which is all over seen here. We have absent vascular pattern. Compare this image with this image, you can see there's obvious absent vascular pattern and friability, erosion. In terms of 3, that is severe disease, you can see that the spontaneous bleeding, just look here, and then we have a presence of ulcers. So that is the Mayo endoscopy score. So in terms of ulcerative colitis, endoscopic score, index of severity, as I've said before, we look at 3 factors, that is the vascular pattern, we look at the bleeding, and erosion and ulcers. So this is just a combination of those, and then you score. I find this to be more detailed compared to the Mayo score. Mayo score is more easy and for you to grab, but this is more detailed for you to understand. So in terms of vascular, we can have normal, that is 0, where you have normal vascular pattern with arborization of capillary clearly defined, as you've seen in the first image of normal. In 1, sorry, we have patchy obliteration. This is patchy obliteration of the vascular pattern. In 2, where the vascular pattern is obliterated, where you have complete loss of the vascular pattern. In terms of bleeding, in 0, where you have no visible blood. In 1, where you just have spot or streaks of coagulated blood on the mucosa, and this blood can be washed off. In terms of 2, where you have luminal, that is mild. This is free luminal bleeding, that is mild, that is free blood, some free liquid blood in the lumen. And then 3, that is moderate to severe, where you have frank blood in the lumen, and it is visible oozing from the mucosa. In the next factor that we said, erosions and ulcers, in 0 you have none. In 1 you have erosions. In 1 you have erosion, that is small defects less than 5 mm, which could be white, yellow, or and flat edge. In terms of 2, where you have deep ulcers, and these ulcers are large defects greater than 5, and they're distinct, fibrin covered, and they remain superficial. In terms of 3, these are deep ulcers, which are actually deep into the these are they actually deep, and you can see they are excavated. So this is just an image to show you where you add the score, you'll get 8. So you could actually grab them. That is one way. Here your vascular pattern is actually partly infiltrated. This is where you can't see actually the vascular pattern. This is a combination of vascular pattern 1. This is partially obliterated and superficial ulcers. And then in ulcers 4, this you can see absent vascular pattern and superficial ulcers. And then in terms of 5, you can see a combination of vascular pattern, which I've already talked to, and erosion and ulcers 2, which you will see the superficial ulcers, and you can see some of coagulated blood. And then see where you have vascular pattern 2, which you said absent of vascular markings or vascular pattern, and 2, where we said we have some liquid or blood, and then erosions and ulcers 2, where we said with superficial ulcer. In terms of 7, we said this is just a repetition, you should be telling me. And then in bleeding 3, what did we say? In terms of bleeding 3, we said this is blood oozing from the mucosa. And in terms of ulcers 2, we already said that is superficial ulcer. And in 8, we see vascular pattern, which is absent. Obliterating, you can see frank pus, and we have deep 3, we said we have deep ulcers. Just to recap from where we are, we already said that we can classify them according to the location, which we already talked about the Mantrons classification. We also say we can classify them according to the disease severity, which is said you can classify according to endoscopy, clinical presentation, and a combination of both. We're already done with the endoscopy, so now we are doing clinical presentation. There are 2 index that we use, but the most common one we use is True Love Witness Severity Index, and this is just the mnemonic. But now, if you're already familiar with the context, you know we already deal with just say True Love is the MHB, which you could just cram that hospital if you're already familiar with the hospital. So this is temperature, which could be a person is not the temperature is not elevated, and then moderate, and then severe. And then heart rate, this is now it's elevated with tachycardia. ESR, which will be less than 30, and if it's greater than 30, that is severe. Movements per day, that is frequent stool movements. If it's greater, this is greater than 6. So less than 4, 4 to 6, and greater than 6. HB, this is HB less than 11, and then 10.5 to 11, and then less than 10.5. And then the last one is blood in stool, which could be present could be absent, present, or absent, and present. So the one I want you to know, or actually should be in your fingertips, is this last portion, because actually you cannot define acute severe ulcerative colitis without defining these last 5 aspects. So this is just a repetition, as you have said. Temperature, heart rate, as you said, ESR, as you said, movements or stool movements per day, 4 to 6, and greater than 6, HB, as you said, and then blood in stool, which could be none, moderate, and large. So there's another score. As we already finished now, we said in terms of severity, we'll do the index. We also do the clinical presentation and a combination of both. So this is just a combination of both. This is just a combination of both. That way we have stools that form that is greater 4, greater than 6, and then severe 10. This is that is American College of Gastroenterologists Ulcerative Colitis Index score. And then urgency, none, mild, often, continuous. Hemoglobin normal, greater than less than 75 of them are normal, transfusion required. ESR lesser than 30, less than 30, less than that. Sorry, greater than 30, greater than that. CRP normal, elevated. This is fetal calciprotein less than 150 to 200, greater than 150 to 200, greater than 150 to 200, greater than 150 to 200. Endoscopy Mayo score, as already said, 0 is normal activity, 1 is mild, 2 we say this mild, sorry, moderate, and then 3 we say this severe. And then we already talked about the ulcerative endoscopy index of severity. This is just a repetition of what we have just talked about.